it's very clear to me that the core of the solution to homelessness is the creation of housing and housing at scale. So without housing, we will never solve this problem. But I think what we have all learned together is that when you take people from the streets or people who have been in the shelters for a long time, put them into housing, there's a lot of issues and things that they want to have addressed and need to have addressed, and that you can't just put them in housing without support. That support needs to be very flexible. It needs to be long-term. We used to hope that you could just support somebody for a couple weeks or a couple months and they'll get stable and then they'll be okay. But most of these folks have lived through hell, and the trauma of their early lives, or the chronic diseases and things that they have suffered and continue to suffer, don't go away just because they're in housing. But now you have an opportunity and a platform to begin to care for them.
I often say that the best thing I can do for my patients is to get them a stable, decent, affordable home. And I think more and more we know that that's the foundation for health. And so how do we start to think about, as a health system, who we partner with in order to make that a reality? So we have always viewed HomeStart as kind of a go-to for housing services, both housing prevention, right? Being able to prevent people from becoming homeless, and then also partnering on when people do become homeless, how do we get them back to that stable housing? And I think more and more we are really trying to build out a portfolio of partners, and HomeStart is really kind of a gold standard.
It takes a lot of hard work, and when I look at the housing workers that we've been working with at HomeStart all these years now, they are ferocious in what they do, and the times they may have to see somebody several times a day in their house or several times a week has been really quite stunning. And people, if we're going to take good care of them, somebody has to make sure they get to their radiation appointment when they have cancer, or get to their and that's where this partnership has really gelled for us. The support that HomeStart has provided for that has just been remarkable, and I think of it as absolutely essential to keeping people in their housing.
When there's a crisis, you kind of just do whatever has to get done in the moment when it needs to get done. And I saw a lot of that happening, whether that's with our colleagues in shelter or with the healthcare system, certainly with HomeStart, when you can just pick up the phone and you can say, next week we're going to rent a hotel and we need you on site, and for them, and to know that they will be there, and they were. And I think it's those types of relationships that we've really been able to see, that people have been able to just be very flexible, be very present, and work through the bureaucracy to get to solution.
This pandemic put a bigger focus on the homelessness crisis, because COVID was something that they had to handle too, and then now it's in the shelters, and that's a big congregate setting, just like the prisons and the jails, where they worried it could spread like wildfire.
We've been worried about the tidal wave of evictions since the beginning, and we sometimes in healthcare are on the front lines of that. Kids come to our ER, or families tell us when they deliver their baby they have nowhere to go. So what do you do in those moments in order to make sure someone is stable?
Well, I think any crisis really exposes the vulnerabilities of people experiencing homelessness, but not right away. So you absolutely need programs like HomeStart, which is probably one of the best at preventing people from becoming homeless. They understand the circumstances that led to folks becoming homeless. They understand what people need to stay in their housing. And so I'm really hoping that they'll be queuing up, and I know they will be, to look at the tsunami that could be coming our way to prevent that.
I think luckily, between really good policy work and really the on-the-ground partners like HomeStart and Boston Medical Center, we're trying to think through ways in which to stave off that tidal wave. I think we're going to have to be really vigilant, because things can change.
There's so much you can do to get involved. Volunteer when you can. If you don't have time, donate money. If you don't have money, talk to legislators. The policies really do matter, and they are definitely felt on multiple levels.
People tend to other this problem, right? It's someone else's problem, I'm fine. And one of the things we have to realize is that we have a collective improvement that happens when everybody has a home. You benefit when people in your community are stable. That means kids are in school. That means people are able to keep jobs. That means people are safer.
The reasons that people become homeless, I tend to think of as legion. So homelessness, I think, is a result of failures of multiple sectors of our society. It's not just one thing. It's not just healthcare, not public health, but it's failure of education, failure of the foster care system, of the welfare system, of the justice system. And all behind all of that, there's the poverty, classism, and racism that is behind that. Many of these folks, especially those who live on the street, have lived through sort of unspeakable trauma and really difficult lives. And their homelessness is the end result of a long process beginning back in childhood. So the solution to help that person have a piece of the dream that we all have is going to require a lot, and a lot more than we were realizing. Housing is the absolutely critical component of the solution, but it's by no means sufficient for the solution. So we have to get everybody housing. We have to scale up housing, get people in, but then to keep them in housing and support them through that and give them a chance at a good, productive life, you need to build community around, you need to provide health and supportive services, and all of that requires a lot of work and a lot of support.
Oftentimes, it saves you more to prevent something than to treat it after it occurs. And so preventing homelessness is a great business model. That is what we need to do more of. And yet, oftentimes, it may be the thing that we underfund the most. And so what are the ways in which we make prevention the rule instead of the exception?